Hello, it's a pleasure to be with you today and speak to you about brittle cornea syndrome. Here's a girl that was referred because of a difficult course after uh, attempted surgery to repair a corneal laceration after minor trauma. There was much difficulty with closing the wound. We can see here from a distance that she's got an exotropia and a corneal scar. She also has blue sclera. In her good eye, it doesn't show up well in the photo, but she's got ectasia and a vertical decimate break. She's otherwise systemically well. We already have the diagnosis. This is brittle cornea syndrome. The brittle cornea syndrome is characterized by a thin ectatic cornea. Affected children often have blue sclera, but this can sometimes get better with time. The big problem is the propensity to corneal rupture. Once corneal rupture occurs, it's very difficult to repair. So much better to use preventative measures in a child with a diagnosis, such as wraparound protective glasses. This is primarily an ocular phenotype, but sometimes affected children have extraocular findings, and very often with time, extraocular findings develop. These include thin skin with a predisposition to scarring, deafness, and skeletal abnormalities. The phenotype is due to biallelic mutations in ZNF469 or PRMD5. It's important to highlight what brittle cornea syndrome is not. It's not osteogenesis imperfecta, and it's not Ehlers-Danlos syndrome. Brittle cornea syndrome belongs to ophthalmologists. Osteogenesis imperfecta and Ehlers-Danlos syndrome are diagnoses that belong to other specialties. Here's one of the first children I've seen with this diagnosis. You can see the apparent large corneas, that's from ectasia. You can see the blue sclera. She developed a vertical decimate break after minor trauma. Her sister poked her in the eye. And she's hyperextensible. She's got ZNF469 mutations. Another girl with ZNF469 mutations, you can see her keratoglobus. Another child with posterior stress lines in the cornea from the corneal ectasia. Another affected child who developed the vertical decimate breaks after minor trauma, finger poke. She's lucky that the cornea didn't perforate. In this affected girl, you can see some frontal bossing from skeletal abnormality and thin skin, which allows you to see the underlying veins rather easily. Similarly, on her back, we can see the veins through her translucent skin. Here's an affected boy who unfortunately had bad outcome after multiple surgeries following minor traumas. I show him because some children have a propensity to skin scarring as well, and you can see that on his forehead. Another affected boy who has severe skeletal abnormality, pectus excavatum, and here's his thin ectatic cornea. Same child, you can see these scars on the skin. This is sometimes called cigarette paper scars. Another sign that you're dealing with this diagnosis. This is an interesting patient. He had been diagnosed with congenital glaucoma and had surgery for this in his left eye. He eventually lost the left eye to surgery. The right eye never had surgery. He has this break and decimate that had been diagnosed as a Habe stria, but in fact, all along, he had brittle cornea syndrome with minimal extraocular manifestations. It's important to highlight what brittle cornea syndrome is not. It's not osteogenesis imperfecta, and it's not Ehlers-Danlos syndrome. Osteogenesis imperfecta is a disease of bone fragility. There's some Other findings that they can have in other systems, but the characteristic finding is the predisposition to bone fractures from minor trauma. There are many different potential gene mutations that can cause the phenotype, but most commonly it's autosomal dominant from COL1A1 mutation. These patients often have blue sclera, that is the type 1, but it has no functional significance and they don't have any predisposition to ocular rupture. Here's a boy with blue sclera and bone fragility. He's got osteogenesis imperfecta type 1. After repair for one of his fractures, he developed a hypertrophic scar. You sometimes see this in osteogenesis imperfecta. Here's a mother and daughter who both have blue sclera. It's a case from the literature. They both also had multiple fractures and ultimately were diagnosed with osteogenesis imperfecta. This is from the New England Journal of Medicine. It's important to distinguish Ehlers-Danlos syndrome from brittle cornea syndrome as well. Ehlers-Danlos syndrome is primarily a systemic disease, and one subtype, type 6, can have ocular findings, but not the predisposition to corneal rupture that we see in brittle cornea syndrome. Ehlers-Danlos syndrome type 6 is quite rare, but here's a case. They have severe childhood scoliosis. They can have ocular findings, as this girl did. She does have bluish sclera, but she does not have the corneal fragility that is part of brittle cornea syndrome. Ehlers-Danlos syndrome type 6 is a problem with lysyl hydroxylase processing collagen. Here's a case from the literature, a Qatari family, the first family to be molecularly characterized. You can see the severe scoliosis. While they can have ocular findings, they don't have this ocular wall fragility that we see in the brittle cornea syndrome. That brings me to the end of the talk. Thank you for your attention.